We're going to get started. My name is Matt Geyer. I'm with Greater Lafayette Indivisible. I'm the treasurer and tech guy, which is why I was on the mic checks. We're going to start it out with Chris doing an introduction about the campaign that we've been running and a little bit about this.
Hi, everyone. My name is Chris Hagerty. I am a director at Greater Lafayette Indivisible. We are here tonight with the Working Hoosiers Vote campaign, which is a collaborative canvassing campaign of Greater Lafayette Indivisible, Greater Lafayette Immigrant Allies, Surge Greater Lafayette, Showing Up for Racial Justice, and the Younger Women's Task Force of Greater Lafayette. And we are really glad to partner with these organizations because we felt a need to get involved in our communities. There's sort of this idea that we know what our communities are like and we know what people's very strongly held local issues are. But a lot of times when we go out into the community, we find out that, you know, there are issues that we are missing. There are issues that people have that they don't feel like they're heard on. So when we did this canvassing, what we did was we went out into the neighborhoods to see what people were thinking and to register them to vote. Unlike candidate canvassing, we didn't use any particular partisan lean to determine who we were canvassing. Instead, we canvassed regular neighborhoods. Our national representative at Indivisible called it guerrilla canvassing because the idea is that we don't really particularly care what people's input is. We care that they're giving input. So that leads to tonight's event because we are then able to take the input that we got from those questions or from those deeply held local issues and turn them into questions for our candidates who are right here with us. We're really, really glad that you're all here. We know that this is kind of a short notice event because most of these events happen usually earlier in the campaign cycle, but we're really glad that our candidates could be here. Throughout the course of the campaign, we knocked 508 doors with 22 volunteers who we appreciate a lot. If you're a volunteer, could you just like stand up for a second so we can clap at you? And we had about 100 conversations with members of the community. And that's a pretty good rate of conversations, and we feel like from that we've gained a lot of knowledge about how our neighbors actually think. One of the other purposes of the canvassing campaign was to identify people in the community who knew about the local issues in the community, who knew their neighborhoods, and who knew what was going on. And then tertiary goal of the campaign was to register voters. And we registered about 67 people to vote during the 5 Saturdays of this campaign. I'm just really glad. I'm really glad about this campaign, and I'm really looking forward to doing it again, maybe with more people and more organizations and on a larger scale next year. But that's basically what we have in terms of our campaign. And now I'm going to turn it over to Matt again, and he's going to talk about our candidates, the format for the event, and then we're going to get going. Thanks so much.
Thanks, Chris. The format for tonight is we're going to ask you a series of questions that we gained from canvassing, like Chris said. We are going to have 90-second responses from each of you, and then if there's follow-up, I'll ask follow-up. To start out, we are going to give you guys 90 seconds each to introduce yourselves before I get started on the first question. So let's start with Sherry.
Good evening. Excuse me. My name is Sherry Shipley, and I am the Democratic candidate for Indiana State Senate District 22, which is encompass most of Lafayette, West Lafayette, with a little section taken out of Main Street in the north side of Lafayette, but the rest of Tippecanoe County. For my day job, I'm a dean at Ivy Tech Community College, where I oversee the schools of business, logistics, and supply chain, and the School of IT. I'm passionate about a lot of things, and one of them is that we have to have good people that really want to represent communities, stand up, and run for office and support those running for office. So thank you all that are here tonight doing this and becoming engaged and involved and educated voters. That's a really important step. I have a number of issues that I'm passionate about: fully funding public schools, making sure we're not spending voucher money to schools that are not following the law in Indiana and in the United States. I work with workforce training every day. Actually, today my day was spent at the Rolls-Royce headquarters in Indianapolis with students at a case competition. So I know about meeting workforce needs, and I understand standing up for workers and just regular families, Hoosier families. I want to protect women's health care. One of the things I talk about, and I hope to get to talk about tonight, is contraception, and I see a lot of Younger Women Task Force women in the room, so it's going to be a rousing night, and I look forward to it.
I will not be talking about that because my daughter's right here. She's 5. Hi, my name's Loretta Barnes. I'm running for Indiana State Representative for District 13. If you're not sure where that is, it covers parts of 8 counties. So it's part of Benton, Newton, Montgomery, Tippecanoe, Jasper, Fountain, Warren, and White counties. I live in Lafayette. I have a 5-year-old daughter who her dad had to work tonight, so she came with me to see our democracy in action. I am a marketing manager. I've been a marketing manager for 11 years. I've been on my company's dealer advisory board for 9 years. I'm a first-time candidate, and I decided to step up and run because my daughter's just started kindergarten, and I saw a lot of things happening in government that I did not like, and I wanted change. And I was waiting for other people to make the change. So I decided, instead of waiting for other people to make the change, that we all have to stand up and we all have to make the change that we want to see. So that's why I'm running, and thanks everybody for being here.
I'm Chris Campbell. I am running for House District 26. That is West Lafayette, the majority of it, except for down the side of the river, all the way up to the county line, out to about 500 west, and then down to 800 south, all encompassed within Tippecanoe County, and then a section of southern Lafayette, past Teal. I am a mom of 2. I'm passionate about my kids and kids getting a strong education, so that became one of my top issues that I've wanted to work on. I'm an audiologist. I care a lot about healthcare, so another issue is making sure that people have access to affordable healthcare. We have a huge opioid addiction issue, which is basically an addiction issue because it doesn't really matter what drug is in the community. They need to feed that addiction. So we need to find ways for people to have pathways into productive lives again. And I want people to have affordable or living wages in Indiana. So we need quality jobs in Indiana. Thank you very much.
Thanks. Before I get to the questions, I want to mention that we do have a timekeeper in the back, and they will hold up times for how much time you have left. That's Ashna. She's doing a great job already. So we can give a round of applause for Ashna. All right, and on to our first question, and we'll just go round robin like we've been doing. This is a 2-part question. First one is, what policies do you support to increase healthcare access in your district? Which healthcare policy challenges do you see as the most pressing in your district?
Well, the closing of so many regional hospitals, not necessarily in our district, but impacts our district. I would have to say, again, that making sure that women and families have access to health care. We've had an attack on Planned Parenthood in Indiana, and we need those for family health services, so that's very important. As I said before, I think that young women need access to affordable, safe contraception because it keeps them in the workforce, so that's an economic issue. And just making sure that all families have access to health care. I think, we've talked about that a lot. We all agree with that. I wish that all of our opponents were here tonight to say what they believe on these issues, because we've said them multiple times. Unfortunately, they were invited and didn't show up tonight to say their piece. So affordable access to health care is a human right.
I also agree that healthcare is a human right. I would love to see universal health care in our country. But while we're waiting on that, in my district, it's a very rural area, so there are particular issues in rural areas that you don't necessarily see in like the city of Lafayette, and that is there's more distance between where someone has to travel to go get health care. So what they end up doing is they wait longer before they go see a doctor. So by the time they get to the doctor, it's usually a more serious issue. Another thing is there are higher rates of certain types of cancers in rural areas related to farming and the chemicals that are used with farming. And in rural areas, so it takes a long time to get to a doctor. There is more prevalent underinsured people. Older generations usually live in the more rural areas. And what's happening is when we're taking health insurance away from people, it affects our rural areas first, because what happens is the health clinics in rural areas can't last as long as hospitals, so they end up closing down, so you have to drive even further to get any kind of health care.
Can I just say ditto? What's left to cover? Well, our veterans also, they have oftentimes, given a limb, literally, for our lives and freedoms. So making sure that they have access to health care. I know that their choices are also limited, and there are just a couple different areas that they can go. So if they have an acute problem, getting in and having that serviced is very difficult for them. Making sure that everybody has access to health care. I agree that it would be great to have a single payer healthcare system, but as we are, as Loretta said, still waiting, it would be great to be able to expand those healthcare services to others when it comes to things like Medicare, Medicaid, expanding that to people of lower incomes. It makes it very difficult for families when they're working 1 or 2 minimum wage jobs if a child gets sick and they don't have access to health care. Not only getting to a health care provider, but being able to afford it. So.
Can I have a follow-up?
Sure.
Just real quickly, that I didn't say, but I also support the legalization of medical marijuana in the state of Indiana, too, so.
Can I have one follow-up?
Really tiny
5
follow-up.
seconds, 5 seconds. Particularly the CBD oil for veterans, because it will help both their pain and their PTSD. So I think that should be something we focus on very quickly.
And if you guys have any follow-ups later, you will have a chance to ask questions, so keep those in mind. Respondents to our canvassing had many concerns about affordable child care for working parents, either because it isn't available or because it is too expensive. What policies do you support to increase access to affordable child care?
Do you want to start? You want me to start?
Let's do it in reverse.
Okay.
Chris, you can start.
Well, expanding childcare, or just expanding our preschool programs, our public preschool programs, I think would also help with some childcare relief for families, also helping the education system. I'm not sure what else.
I think partly letting people have access to the subsidies that are actually available to the state. Right now, I think it's like 10% of the people are actually receiving help with child care when there are a lot more people that qualify. So if we're not designating enough money in the budget to cover the state need, then we need to address that, particularly coming up in this year because we're going to be addressing the budget. So I believe child care should not just be a woman's issue or a poor person's issue. It should be everybody's issue, and I think it needs to be dealt with.
Well, this community's lucky that they have so many childcare options. There are a lot of counties in the state of Indiana that are true childcare deserts, but many of the options that we do have here are out of reach. I think there are a number of things we can do. We can help educate those in-home childcares agencies and help them become certified and not be scared of that. So help them through educating them. We've got to give more money to scholarships for students to be able to teach that or to be able to go into these fields. We have the Teach Scholarship, but there's been some issues with that with students. So it's you go to school, you at least have to have a certification for classes to get a decent job in some of the healthcare facilities. And then you go and you make really, really low pay. So it would be really nice if we could actually pay our childcare providers a little bit more than we do. But also, we definitely do not want to be putting students in debt to earn an early childhood education degree. So I think that's one place we could start to expand those. Making parents, sometimes they have to qualify, they have to either have a job or be in school. Let's let them have that and then put them on the path to school or work instead of making that a condition sometimes of those dollars to help them get a leg up and then get them into the workforce or into schooling.
Thanks. The state of Indiana funds public schools primarily through sales and income taxes, and distributes its share of the school's money to school districts per student using a formula to determine a differential need of students in the district. Respondents to our survey expressed a desire for politicians to support public education. Which policies do you support to strengthen public education?
You going first? Or? Okay.
One of the things I support is seriously looking at how we're taking money out of the public schools and putting them with a voucher system. What that does, particularly in rural areas, is there isn't a private school in the rural area. So it's taking the local money out of that public school and taking it and sending it to Indianapolis or wherever. So it's not benefiting the people in that area. Another thing is vouchers, where the idea of vouchers is great. I want to send my kid to a school that's better. Well, I would rather take the money and pay our teachers better, improve things in our public schools that need improving, because public schools are available to anyone, no matter who you are. You know who gets vouchers? They say people in need get vouchers, but then the school gets to decide which of the vouchers that they're going to pick. So are they picking special needs kids? Are they picking, it's a layout for discrimination. And I think if you're using taxpayer funds, then you cannot discriminate.
Well, I feel that the money that has been diverted into the charter and the voucher program has been detrimental to our public school system. There is a school that had to shut down their school due to lack of funding because of this diversion of funds. They're now busing their kids 2 hours and 15 minutes one way on the bus. This is unacceptable. We need to fund our schools. We need to be able to educate our population so that every child has access to an education system. When we're diverting funds, we're cutting out, we're depleting the funding of our public school system and not educating those kids that are left in those schools. Our teachers are not getting raises. Our teachers are working at 2009 salary levels throughout Indiana on average. Services are being cut. Children aren't getting the services they need because of the lack of funding. We need to make sure that we're fully funding our schools and not diverting it to private. We need to fund our public schools first is my main issue.
Well, there's actually a really great Washington Post article that I just shared on my Facebook and Twitter page today. So I think today or sometime this week. I don't know, the days are running together. But I recently shared that really outlines how they changed the funding model in the state of Indiana. And actually, it was Governor Daniels that gave us our current state of public education funding. The whole funding model is so messed up in terms of how communities and which communities can raise property taxes, and the way the funding is. Local schools have to pay for transportation, busing, some other things, and you're seeing the result of that in the schools that the state has taken over. So the whole funding model is quite a mess, quite honestly. I agree with these ladies that vouchers are a problem, but also things like homeschool children or homeschool families get to deduct $1,000 a year on their income taxes for school supplies, yet families have to pay lots of money for school supplies. So that, I believe, is a problem, and it should be fair that if you go to a private school or a public school or homeschool, again, fairness and equalness across the board, either they all get a tax deduction for school supplies, or nobody gets a tax deduction for school supplies. And also, we spend $25 million plus a year on testing that neither prepares students for the workforce, nor does it tell us how successful they'll be at the next level, whether that next level is high school, whether that next level is college. And when we could put that money back. Sorry.
Thanks.
Mrs. Hughes.
I have a lot of questions to get through, but I do want to have a follow-up. Sherry, you touched on that. The state funds schools through state tax and income tax at a higher rate than most states. Property taxes are capped at 1% by a constitutional amendment. Is this the right mix of school funding to ensure good educational outcomes for students? And I'll give 30 seconds to each of you.
Clearly, it's not. If you look at what's happening, and it was designed, quite honestly, to have sort of a private school model, a voucher model, take over. So no, it's not a good funding model. It's not working. And when you don't just take the money out of those schools, what you take are the families out of the whole school community. So you lose those families that are volunteering in the classroom and they're, the place where students can go after work or after school and things like that. So it not only is the money, but you're decimating that whole school community.
As Sherry said, it clearly isn't enough, because the foundation of our entire society and community is from our public schools, our children. So to not invest enough money into their futures, into our country's future, I think that is sad and needs to be changed.
And again, I agree with both of them. The most important investment that we can make in our state is our children. If we are not educating our children for the future, for a future to be able to have a job, to be productive people, to have access to education is the most fundamental thing that should be provided for them. And if we're not giving them enough.
Thanks. Several respondents expressed frustration about their special needs children's experiences with the school system. What steps can the state take to ease the burden of advocacy on parents? Who must learn to navigate the complexity of federally mandated, state-enforced individual education plans? It's a wordy question.
Wow. Yeah, well, I'll take a stab at it.
Sure.
This problem is so complex and multi-layered. There is really no 90-second answer to this. If there were, we would have solved it a long time ago. But this is what happens when we lose $3 million a year out of the local public schools in Tippecanoe County. And again, the private and charter schools don't have to take those students. Can you repeat the question? I'm sorry, I lost my train of thought.
Sure. What steps can the state take to ease the burden of advocacy on parents who must learn to navigate the complexity of federally mandated, state-enforced individual education plans?
Yeah, it's terrible. One of the things actually that we had when the ACA or Obamacare, and I think we still have those, are they had like these guides and people that the state paid that you could talk to. Wouldn't that be great if we had more family advocates to help work through this myriad? At the entry level of that problem, all the way to the crisis level of not having enough beds for students or children in full-out behavioral and crisis, we failed them. So it's also a public health issue, and our public health policies have an impact on what's happening at the schools. And again, these are problems that are landing at the doorstep of schools, but these are problems because of family situations, drug situations. So public health funding has a lot to do with this as well. Aids in the classroom, support, that type of thing. Medicare funds for just nurses' aides and that type of thing. So I feel like, sorry. Thank God. I was rambling.
Someone I work with has a daughter who has Down syndrome, and I talked with him a little bit about what issues he was facing with his daughter, and one of the things that he mentioned is they live near North Montgomery County School, but North Montgomery, they were told they don't have the resources at that school in order to best help his daughter, so now she has to go to Crawfordsville School. So what ends up happening with that, they're used to it by now, is his daughter's best friend, who has Down syndrome, lives in Crawfordsville, and he gets to participate in after-school programs. He said one of the things that's hardest to him is his daughter doesn't get to spend much time with kids outside of the special needs class. So what he would like to see, and so she can't stay for the after-school things because the bus has to take her all the way back to North Montgomery. So what he would like to see is to help her better learn for the to be in society is to be able to interact better with other kids in the school. And I think that we should invest or support programs such as InSource, parent organizations that combat this issue.
I grew up with two special needs siblings. My younger brother was profoundly hearing impaired and a learning disabled sister. So I know, 40 years ago it was even more difficult to navigate the individual education plans. I know it's come a long way, but then it goes back to funding and time, and that's the whole thing about an individual education plan is these are special needs kids, and they have special needs in the classroom that are unique to them. And there isn't a one-size-fits-all for education. And when you're not funding the school, and I know they have a lot of difficulty getting paraprofessionals who are being paid less than $10 an hour. It's difficult to find somebody that's willing to work at that rate for the amount of time and commitment they have to spend with those students. So I think it still comes back to funding. We also need mental health providers in the schools that are evaluating for those extra special needs, food insecurity, abuse in the household, or the special needs that do get missed. So there's a lot going on, and we put a lot on our teachers to get the training, but we need extra help in the schools and funding to make sure that these are addressed.
Staying on teachers, adjusting for 2018 dollars, teachers in Indiana make 19% less than they did in 1999. Do you support legislation to increase teacher pay across the state?
Absolutely. Yeah, our teachers are underpaid. Average teacher is working less than 5 years now. A lot of teachers are going into teaching and not making a living. We've got teachers on food stamps in the state. Why would you go into teaching at this point when you could be coming out with, $80,000, $100,000 worth of debts and get paid $30,000 and not be able to pay off that debt and teach and support yourself and maybe even a family? So we need to compensate our teachers. We need to appreciate and show that they're valued, because to me, they are doing the most important job, and that's preparing our children for the future, and they are the future. It's the foundation of the future of our state. So this is a huge investment and a huge commitment to put on somebody, and to not compensate them. I feel like we're doing them not only a disservice, we're saying we don't respect you enough to give you a living salary. So it's very important that we do start to compensate our teachers well.
Here's one of the problems, that if you're going to have teachers that help shape the brain and life of your children, is you will have teachers that are overstressed. They're working more than one job at a time. But then the one particular thing about teachers is that, besides not being treated like the professionals they are, is they have to put so much of their heart and their soul into teaching. So it's not just a job to them. It's like being a doctor or a nurse. You care about the welfare of the children that you're taking care of on a daily basis. And if we cannot pay our teachers and help them not have to focus so much on testing, but focus on the love of teaching and the love of learning, then we're going to have an even bigger problem in the future.
Will you repeat the question, please?
Sure. Adjusting to 2018 dollars, teachers in Indiana make 19% less than they did in 1999. Do you support legislation to increase teacher pay across the state?
That's why I wanted you to repeat the question. So, do I support legislation to increase teacher pay across the state? I'm not sure, because if we do that and then we don't give the schools any money, and a school has to say, well, then I'm going to have to cut my custodians or my nurse or my English teacher or something like that. So I think we have to be really careful, answering. And I'm not calling it a flip question. I'm not, I assure you. But I don't want to give a flip answer to something like that when you ask a very specific question. So what kind of legislation would I support? Funding, a higher base pay for teachers, being able to, because I think we got rid of this a few years ago in Indiana, but being able to pay teachers when they come in with a bachelor's degree, if they come in with a master's degree, you pay them more. If they come in with a master's degree and 15 years experience, you pay them more, so that teachers with experience and veteran classroom teachers, they have mobility to go into other schools, but sometimes they can't move because they're making too much money, and schools want to pay somebody that's right out of college that they can pay less than a veteran teacher. So those are some of the things that I would like to see us look at. But yes, and definitely we need to pay them more, but not at the expense of other vital school functions. But again, it comes back to funding.
Indiana's minimum wage matches the federal minimum wage of $7.25 and the tipped minimum wage of $2.13. Do you support raising the state's minimum wage? Why or why not?
Is my turn to go first?
Yes.
Yes, I support raising the minimum wage, not to $15 an hour right off the bat. I think that would really hurt a lot of small businesses. I definitely think we need to raise the tipped amount. My first job, I was actually a car hop at the Bobolink in Royal Center, Indiana. And I think we were making about that, or $1.80 an hour, and that was 40 some years ago. So I think we need to pay our servers and our tipped staff more, and that's a good place to start. I think we have to be really careful about just putting out arbitrary numbers because there are certain communities other counties that $15 an hour, you can live on $13 an hour, but try and live on $15 an hour in Hamilton County, get an apartment in Carmel or someplace like that. So I think we do need to raise the minimum wage incrementally, keeping in mind small business owners in the long run too.
I agree with what Sherry said, and I also think that we need to focus on more than just minimum wage. I think that one of the things that's happening, along with big corporate tax cuts that corporations just had, is they have all this record profit, yet they are content in paying employees at a wage that employees settle for, because what are you going to do? Go try to find another job. So what I want to do is incentivize companies that are actually paying their employees a decent wage. So I want to give those companies things like tax cuts and stuff like that in order to, we have a stagnant wage in Indiana, yet corporations have record profits and they get tax cuts. There is something fundamentally wrong in this situation, and I think that it's up to the state Senate and state legislature to change this.
Yeah, we had the lowest wages in the Midwest. While I think I mentioned that cost of living has gone up 30%, the wages have only gone up 6% in the last 9 years. I think we also need to look at what our other surrounding states. We are equal with Kentucky, but the other surrounding states do have higher minimum wages. It would be nice to be comparable to those states. I think we need to incentivize companies to somehow come in and that are offering those quality jobs that are offering more than that minimum wage and allowing people to make a living in Indiana. I'll add.
We're lucky enough to use the this union hall, the IBEW Union Hall. Indiana is a right-to-work state where unions now cannot require members to pay dues to cover collective bargaining. Explain your understanding of right-to-work, and do you support right-to-work?
I do not support right-to-work because I believe in the fundamental ideas of what unions are trying to do. What unions have done for us over the years and what they currently still try to do is give workers collectively a larger voice against the company or corporation that they work for, so they can have safe working environments, so they can have better wages, so they can have holidays off, so they can have weekends, so they only have to work 8 hours a day. That's what unions helped bring to us. What Right to Work has done, the term itself sounds really great. Everyone should have the right to work. But what it's trying to do, to me, is take away the voice of the collective worker. And it's taking away construction workers' ability in order to get a decent pay when they're trying to do bids. And what happens is they bid for a job, and then another company comes in and undercuts, and then that other company hires temporary workers. And what do? They don't have the skills that the apprenticeships that the union workers had to go through. So what happens is you get a building built or a bridge built that's not quite as good construction-wise as these workers who have worked their whole lives. And I have to stop, but I don't like right to work.
I can tell. Yes. I agree with everything that Loretta said. It boils down to corporations taking advantage of working class families. And I don't want us to be divided that way, because these are also our friends and families that work in these corporations throughout the state too. So sometimes, it's just another way to divide us. But no, I don't agree with right to work policies, but this is what your supermajority in the state legislature gets you. And so this is why it's imperative that folks show up and vote, or we will continue to have policies like this that hurt families.
What the right to work has done is made it so that there's the ability to always find that person that's going to take a job at a lower wage, or maybe the same wage but not take the benefits that are offered to the other employees. The wages have gone down in Indiana and continue to go down. The right to work has also increased that probability that wages will continue to decline. In Muncie, I just heard the Muncie take over the schools, even though the teachers have a union. The Muncie schools, the Ball State chose not to negotiate with the teachers union. So they don't have a voice. So that collective voice is very important. People died for the right to unionize. Personally, I think the right to work legislation is union busting, basically, and we need to repeal that, and we need to give workers a right so that they can have a voice again. We can give them the voice, but I hope that they use it once we do repeal that. Because it's time that workers stand up for themselves again, because it sounds like we're going to have to fight to be able to have living wages in Indiana.
Thank you. Respondents frequently cited renter-landlord issues as a deeply felt issue, with many feeling as though their rights are either not clear, not enforced, or inconsistent from county to county. Which policies do you support to enhance and or clarify renters' rights on the state level?
Because this is an issue that I really don't know anything about at a level enough to get up here and talk about it. I will say that there are so many restrictive laws coming out of the State House that communities find themselves really their hands tied in terms of dealing with and negotiating. We saw an issue here where they had to raise the fees on renters recently to do inspections. And the reason they had to do that was because of some of the policies coming out of the State House. That's really the only thing they could do to get money for inspections and things. Again, this is not something that I could talk about with any clarity, but I would love to learn more about this and dive into it and make a good data-based, research-based policy surrounding it that helps people and doesn't hurt people.
I have been a renter. I am not a renter currently, but some of the issues that I have seen come up with when you're the renter is you don't really have any of the power. The person, the landlord, can put any kind of security deposit on it, and then when it's time for you, when you move out, they can come up with all kinds of different problems they found and basically keep your money. I know because that happened. And I think that there should be a little more regulation on the level of security deposit that they're able to put on you, and there should be certain regulations on what they can look at in order to keep your money in the end. I need to read up more on tenant issues. I do know that as a renter, you should have just as many rights, personal rights, as the person who is renting you the apartment or house.
Yeah, I guess I can't say that I know of any renter rights, but I know that it is difficult when you are the renter. If you feel that something is unfair, you don't usually have money to fight back. As a renter, as a student, of course, I've rented every year, and when I was a student, and oftentimes, at least part of the deposit wasn't returned by, usually what I would consider questionable reasons. I know the first time I cleaned our apartment quite thoroughly and was still charged for cleaning fees. So I don't think that there are necessarily any protections, or if there is, it's difficult to fight back as a renter because they usually don't have the money to fight back. I know recently a Purdue student did fight back because he was being charged for something he didn't do in his apartment, and then even though he continued to pay rent, he was charged late fees because then the rental property owner said that was towards the repairs. The student had enough money to fight that, and the rental property owner actually lost. So, like I said, they usually can't fight back.
We have 2 more questions, then we're going to turn it over to everyone in the audience. Want to respect your time, so we're going to try to get through these, but they are very important. The death rate from opioid poisoning has increased by 270% from 2010 to 2016, with over 700 deaths in 2016 alone. Which policies already enacted by the state do you support to reduce the harm of opioid use disorder? And which policies have not yet been implemented that you want to see implemented?
I don't know the specifics.
I'm sorry, we were talking. Can you repeat the last part of the question?
Sure.
Officer?
Which policies already enacted by the state do you support to reduce the harm of opioid use disorder? And which policies have not yet been implemented that you want to see implemented?
Okay. Policies that have been implemented locally because we can't arrest our way out of this program or out of this problem. We have to have trained, qualified law enforcement that carry Narcan. We have to attack it as a public health issue, which I'm glad that Tippecanoe County has done that. With the needle exchange program, even though I know it's very controversial, and a lot of people don't like it. We were identified as a county where diseases like hepatitis were starting to become out of control, and that's why we were allowed to have that here. So we have to address it as a public health issue. A couple things that I think we could do. So when someone goes into the hospital or jail or hospital particularly, and they're either going through withdrawal or overdosing, particularly through withdrawal, they give them prescriptions and medications to help them with that. But why can't we start with medication that will actually start treating their addiction while they're in the hospital? So I think that's one of the things that we could do that. Allowing just an education so that pregnant women that are having drug addiction issues, that we get them off the streets, that we have doctors who will see them. There aren't even that many doctors in Indiana who will actually see a pregnant woman that's having a drug abuse problem. So we've got to use all of our resources and come together to solve the problem. And fund DCS again because that's the collateral. Sorry, I didn't.
Oh no, we broke it. Thanks, Chris. One of the things that I would like to see done is I would like to see us separate the drug user from the drug seller. Both the drug seller and the doctor who prescribed too much medication. One is criminal to me. A drug user, they're addicted, and I believe that and I don't mean just opioids. I mean all of the people in the criminal justice system right now who have lost their families because they were on crack at some time. and they've been in the system, but now we're focusing on it because of opioids. I would like to look at everything, and if the only criminal act you've done is because of your addiction and you got caught with opioids, I want there to be a process of where you're actually getting help. If you're a doctor and you prescribe too much medication, I think there should be criminal procedures to prevent that in the future. If you are selling drugs, that's a criminal act, and I think it should be treated as such. But I believe that insurance should cover your treatment in order to get help. And we should stop treating these people like they're second-class citizens just because they went down this path that they can't get out of right now. And I have to stop.
This is such a huge issue, and it has just exploded in our state and has to be addressed at so many levels, from education of our children to help prevent the addiction issue, to the treatment and to the care. When they're arrested for drug-related issues or as a result of their addiction, committing crimes, getting the care and the need, not only at the prison system, but that help that they need afterwards. Once you have that addiction issue, they're going to have that for life. So this is a lifelong issue. It doesn't matter what the drug is. If they're addicted to opioids, if opioids aren't available, they need to feed that addiction. They're going to go for meth. They're going to go for spice. Their brain is no longer functioning. It becomes a mental health issue. In our own community, you actually have to have good insurance to get care for any mental health issue, including addiction. We need better access for people without insurance to get help. Usually the addict doesn't have a job, much less. And sometimes they do. Sometimes they are functioning. But we do need better access to health care so that people can get the help that they need.
And our last question, this is one that I've personally been focusing on this year. So Indiana has one of the lowest rates of voting in midterm elections of any state. Actually, today there was a study that was released by Northern Illinois University that Indiana has the 47th hardest state to vote in. So there's only not that many states there that are worse than us there. Why should people vote? And more specifically, why should people vote for you?
Okay.
Yeah.
Okay. Well, you should vote because, well, I'm not going to tell this audience why they should vote. Everybody here knows why they should vote. Why should you vote for me? Because I'm sitting here tonight, because I'm taking the hard questions, because I'm stumbling through the ones that I don't really have a deep, full answer to, because I haven't been in Indianapolis for the past 20-some years, cozying up to lobbyists. I've been in the trenches, volunteering in public schools, working in my community, working every day just to try to change lives. The other reason you should vote for me is that I'm not going to be handled or owned by anybody. So that's a good thing, I think, for voters and constituents, that I will go down and truly do the right thing. I want to be your representative. And are we going to get a closing too?
Yes.
Oh, okay, thank you. I just want to make sure. Okay. Yeah.
You should go out and vote because you have the free opportunity to do so. You should go out and vote because they tried to take children's health care away from them. You should go out and vote because they did put children in cages.
Yes, thank you.
When you don't go out and vote and you don't speak up, you have people in government that take things away from you, that try to control your body, that try to control how much money you have, that try to control you. The biggest thing we have in this country is our collective voice, and that's the vote. I think that we should teach more civic-minded things in our schools, teach them, what do you do when you go to vote? You don't have to fill out every box when you go to vote. This is what it means. This is what Republicans stand for. This is Democrat. This is Independent. This is Green Party. Teach all of the options so people can make educated guesses. I think you should vote for me if you're in my district. If not, probably shouldn't vote for me. You should vote for me because anybody can learn procedure. Have I been in office yet? No. I've been on a dealer advisory board where I look at budgets and small businesses and large businesses. You can teach procedure. You can teach that. What you can't teach is caring and compassion, and I have that. So thank you.
And you should vote because people died to give you your right to vote in some cases. We weren't all white landowners when we started. We've had the privilege of being born into a society where we do have that right and that freedom to vote and to have a voice. I want you to vote for me because I want to be that voice. I want to be the person that you talk to, that you tell me what it is how you want to be represented in this state. I don't feel that our current representative is doing that. I don't feel that our current representative listens when the opinion doesn't match her own. I want to be that person that you feel that you trust. I want you to feel that you can talk to me and that you will be heard. I'm not going to block you on Twitter. I may disagree with you. I'm sure that I'm not always gonna do the perfect right thing, but I'm gonna do my best, and I want you to know that you guys matter, and that's the most important thing we can do is do this together.
All right, that concludes our prepared questions. Right now, we're going to open it up to the audience. If you want to line up by Chris over here.
Just one thing. Before we start, I just want to acknowledge something that's been brought up a couple times. We invited all the candidates participating in local Senate and House races to this forum. As you noticed, a few are missing, right? So we don't have any of the Republicans with us tonight, even though we sent out invitations and we were really hoping that they come and talk with us tonight. And also, I believe Representative Klinker is missing because she had a scheduling conflict. Either way, I'm really glad that we have the candidates that we have here. And at this time, I'd really like to open things up for people to ask questions. But before we do that, we have a couple people who canvassed with our campaign. And if you're willing to, Jessica and Eric, if you're willing to share your experiences with canvassing really quick before we get into questions, that'd be great. Thanks so much.
So the main takeaway I had is I was nervous to do it. I was like, I don't want to go door to door. It's going to be awkward, and it's actually not. You kind of get your spiel down and know how to talk to people. And at the end of the day, you're literally just saying, hey, what do you care about in this community, and how can we make a change? And so it was really awesome to get out there, talk to people, and just see what the experience is like. I'm new to Indiana. In fact, I just changed my residency so I could vote. This was a new move. So trying to get the lay of the land out here was really cool. So if you're apprehensive about doing it, or you're like, that's not my jam, I would not feel good in going door to door, don't sell yourself short. You can definitely do it. You can talk to people. And I've learned a lot about it. So I definitely recommend. What'd you say? Oh yeah, this very kind constituent said, or gave me a jade plant because she's like, it's gonna die, and I have too many, so she gave it to me. Because that's what I found was helpful. Connect. I was like, oh, I love your garden. What's important to you, right? You can have conversations like that. So yeah, it was a cool connection to make, and I got to 30 seconds. Okay, that's what I got. So yeah, so don't get involved. Get involved somehow. Do it. Participate because it's not scary, and it's a rewarding, meaningful use of your time. So, yeah.
Is it on? Hi, my name's Jessica. I'm with the Younger Women's Task Force. I did lots of canvassing before I canvassed for Working Hoosiers Vote, but this was the first canvassing I did where the goal was specifically to listen to people. And I'm really glad to actually get to do this little part after hearing what you three had to say. Because, am I here now? Okay, sorry. Sorry, live stream people. That beginning part was a mystery. So, a few of the things that I learned canvassing here in Lafayette was that issues about tenants' rights, which the three of you did admit that you maybe possibly don't know a lot about, were huge. That was one of the main things people wanted to talk to me about. Issues with landlords, issues with quality of property, safety issues, things like that. So
Thank you.
inquiring minds want to know. Another thing that people wanted to talk a lot about were childcare, specifically related to the IEP programs, and how a lot of people are struggling to advocate for their children in public schools, especially here in Lafayette. I talked to several parents like that. These are just working parents. I heard a couple answers tonight that kind of conflated the drug addiction, health issues in our state, also like with the IEP program and like student need. But I think it's important not to necessarily mix that language together, because a lot of the people that I talk to seem to be perfectly capable parents and still need that support. So it's not necessarily that they have those issues, but that's all. I don't need to talk too much.
Thank you, Jessica. That was nice. Thank you. And thank you so much for all your experiences.
Yeah, so if you want to line up by Chris, and he'll hold the microphone. You can ask whatever questions you need. We want to allocate as much time as possible to that, if you have any. And I just want to say personally, too, I was a part of doing the Working Hoosiers Vote Coalition, and it was fantastic, meeting all these new people and meeting people in my neighborhood. It was really fun. So I hope we can do it next election cycle, and I hope you all join us.
And in fact, if you do want to join us, we have sign-ups right over there. Does anybody have any questions for the candidates they want to put up at this time? Oh, wow.
There might be one. Oh, yeah.
All right, we got one.
Awesome. Thank you. Thank you all for being here. And nope.
Oh, yeah, if you want to get in there, you could.
This is why I can't have nice things. My question, since I've been living in Indiana, I'm a graduate student at Purdue. A big thing that I've noticed, I'm in a PhD program with a lot of really brilliant people. I'm in graduate school with a lot of really brilliant people. Not a lot of them stay in Indiana. The average age is increasing, and we're really struggling to keep people in the state. And I'm interested to hear what ideas the three of you might have to help solve our brain drain problem.
Yeah, so I'll take that. I don't think it's that they're because of a lack of jobs or opportunity for those people. I've talked to a number of students at Purdue as well, women of color, folks in the LGBTQ community, and I hear people say time and time again, I can't wait to get out of Indiana. And that's what I think the Republicans and supermajority do not get, is that the repressive social issues that we continue to have, that we continue to legislate in the state of Indiana, are driving young people, talented people, entrepreneurs out of our state, not just our community, but out of our state. And while we have jobs, we have the education institutions, we have a great workforce ecosystem. Those social issues are impacting people, and they don't want to live here. Quality of life, we are 48th in quality of life, so public health issues and mental health statistics and what we're doing impact that. And so those issues are catching up with us, where I think they only want to look at bottom line and revenues and unemployment rates and that kind of thing. But those aren't the things that people are looking at when they want to flee Indiana, and we need to have policies where everyone is welcome and everyone wants to come here and build families and build communities and build businesses and companies here. So I think our social issues are really impacting that.
I think one of the issues that you have there's nothing wrong with being conservative with economy, one of the issues that you have with being conservative is you no longer are allowing people to use that creative flair that they have in the working environment. No one wants to work 8 to 9 to 12 hours a day, even though they have to for their family. What they would like to do is be inspired and excited about something. And I think what happens in Indiana is everything becomes, by the supermajority, conservative and must be one way, and you're finding you're no longer getting these job opportunities where you can do things that might be outside the box and might inspire you to be the next Einstein or things like that. So along with incentivizing companies to pay their employees better, I would also like to see us challenge ourselves and incentivize individuals that graduate to come up with new technology and new ideas and use that to advance Indiana in ways that I think a conservative approach doesn't allow.
I've learned some things from these two. I guess, my understanding is that it is the lack of those quality jobs where Sherry said that there are the quality jobs, but it absolutely does make sense that people, I know my daughter couldn't wait to leave as fast as she could to run across the country just to go to school, and I wonder if she will ever want to come back. She certainly likes the societal difference that she is getting in Massachusetts, which is much more open and much more welcoming, and so I can definitely see how that would be an issue. My husband and I graduated from Purdue. When we decided where to live, we did come back to the Purdue area. We do kind of live in an area that's kind of basically a bubble, where we do have the access to those technological jobs that was available for both of us, and the great school system where we could raise our children. Maybe creating more environments like that throughout the state would be more encouraging for people to want to stay.
Hi, thank you so much for being here tonight. I'm going to get into the frame. My name is Kirsten Gibson. I'm one of the organizers, but I also live in Lafayette. I'm really curious. Over the summer, I did an organizing training, and one of the lessons learned that was shared was they had helped get a candidate elected, and then once that candidate was elected, they kind of went back on their platform because they were like the only Democrat. It was a city council member. They were the only Democrat on the city council. So it was really difficult for them to get a progressive agenda passed. And since if you are elected, I mean, I hope all three of you are elected. But in the event, right, that you're going to go into territory that's unfamiliar and unfriendly to your agendas. So I'm just wondering how the folks that vote for you can hold you accountable once you are in office, if you have a plan for that.
Well, what I'd like to get across to people that would vote for me is no matter what environment I'm in, whether it's where I work and it's the CEO talking to me, which sometimes gets me in trouble because I will say what I think and what I mean at that particular time. So even if I have struggles getting something passed, I believe that communication with the people that helped get me there, letting them see that it may not happen this time, but I'm going to try again and again. Whatever I promised I believe in, what I told them that I believe in, I will fight for, and I will do everything I can And I believe one of the first things that we're trying to do is break the supermajority. So people actually have a voice. So it doesn't really matter if you're Democrat or Republican, independent. I don't believe one party should be able to have such a majority, because in the end, they don't end up having to do anything for you. So if I don't get it done the first time, my constituents will see that I fought for it, and will see that I will try again and try it different ways, reach across the aisle. And if I can't get it done one way, I will try to do it another way. So I will just do my best and be transparent.
Well, I feel that I'm really hoping that the communication between myself and the voters continues, that I do get the feedback from them, what they would like to see and what I can do in the State House. I know that will probably be limited if we are still in a minority, but that's, one of my goals is to keep fighting and to keep fighting for what I believe in and what for my voters believe in. We can only be successful if we fight together. And there's also, we will have to work across, we need a bipartisan voice also. We need to be able to find that common ground that actually gets things done. I know a lot of times we may have the same goal, but we may be coming at it from different directions. So that's also going to play into it. How do we get to that common goal? And I know that we are probably going to have a lot of fights. I know that there are probably going to be people more senior to us that are probably going to be telling us how we have to vote in something. And, we're going to have to answer to that. So I know that we're walking into a big struggle. It's not about me, it's about us and getting things done.
When I decided to run a year and a half ago, I really had no idea what I was getting into. A year and a half later. But the reason I did it was a lot of reasons. It was time for good people who really cared about the community and for more women to stand up and take a risk and run for office and stop being represented by, no offense to the old white dudes in the room, but old white dudes. And I'm married to an old white dude, so I love him very much, So. But I'm 56 years old. I've been married for 31 years. I'm in a good place in my career. I've reached self-actualization. Thank you for those in the crowd that got that. I'm not doing this because I need this job. I really want this job so much. I really want to go down and mess with the patriarchy a little bit, not going to lie. But I really want this job, but I don't need this job, and I don't have to have this job, and I'm not going to do anything or say anything or take anybody's money just to get this job, and I'm not going to do anything or say anything or take anybody's money to keep this job. It's just who I am. And so will I always do things that people agree with? Probably not. Probably not. There are probably going to be things that my supporters will say, why did you do this? And I will be honest and say, because this is what the data and the research and the people I talk to, and I think this is the best decision for everybody involved. And that's how I've tried to live my life, and that's how I'm going to continue to do it when I go to Indianapolis.
Thank you.
Thank you.
Does anyone else have any questions? Oh, we got one.
Oh, no.
Okay, so one of my favorite things about canvassing and going to every door is that you just get to meet so many people and you get to have so many unique conversations, and some of them feel very similar. You start to think oh, I wish this person from 3 blocks down could meet this person from 7 blocks over, because they would really maybe she wouldn't have as many jade plants because she'd have more people to give them to, right? But so I want to hear from you. We'll make this a fun one because I feel like my reputation is given a hard one. Tell me about, hopefully you've been on Door. I know Alana's been on Door for a long time and has been posting all those photos. But tell me about a really good conversation that you've had on Door with a constituent. Who wants to go?
I'll share a couple, actually. I was putting out yard signs, and I knocked on this door, and a man came to the door in his underwear. And I was like, oh, I think I have the wrong house or something. He said, no. And then he said, do you care if I put some pants on? I want to talk to you about the sheriff's race. And I said, not I'm going to put pants on, but do you care if I put pants on? I'm like, no, I think it'd be grand if you put pants on. And then I'm happy to talk to you about our guy, Bob Goldsmith. So anyway, that was an interesting one. But I will tell you I've had a couple conversations recently when I've been calling voters, and I've talked to some older women, quite honestly, who are sad and angry. There were a lot of women who the Kavanaugh hearing, older women in their 70s and even 80s, who this really dredged up a lot. And when I started talking to them, they are gobsmacked right now what's going on. There was also an immigrant woman that I talked to who said, she was 80-some years old, and she said, I risked my life bringing my 5 kids over here, and now I don't want to die with this being the state of this country. What did I do? And I've got her number, and I tell you on election night, or the next day, when I win, I want to go see her, because I want to say, no, this is not who we are. This is not how it's going to be. We are better, we can do better, and we can vote and change this.
I've had a little bit different experiences than nobody's come to the door in their underwear. Somehow, I must be knocking the wrong doors or not in Bob's territory or something. Some of the best experiences, and we've knocked a lot of doors because I have 8 counties. Again, I said that, but that just means that we go to particularly interesting areas where we've never been our entire lives, didn't know it existed, and you go down these streets, and then you knock on a door who you're pretty sure the person's going to be a serial killer. In areas where you're like, everywhere around says no trespassing except this one house. So you knock on it, and this man comes out with 5 little kids. They come out, and he's talking, and you're pretty sure that he has a Trump 2020 flag, which my campaign manager has gotten plenty of pictures of me knocking on those doors too. But, and he sat and listened, even though he's usually Republican. He sat and listened because he did not like what was happening in our state and in our country. And so he asked me questions about the Electoral College, and he asked me questions about what I wanted to see. And I will tell you what I told him, but it says stop, so I cannot tell you. But
Go ahead, finish your thought. Go ahead.
Yeah,
finish
go
your
ahead.
thought.
No, you don't deserve it.
I'm just saying that we've had the most interesting conversations from people all walks of life, and that has been the greatest experience to me as an introvert, is knocking on doors and seeing that we're not all that different.
Yeah, I've had a lot of similar. There was somebody with they had pants on at least. Yeah, you meet all kinds of people, from the guy who has a lot of flags, large flags in his yard, and I'm thinking, okay, why are they sending me to this house? Oh, they pulled a Democrat ballot in the primary. Okay, I'm the Democrat running for office, and they say, well, then you've got my vote. I've always voted Republican, but this time I'm going to vote for Democrats because I don't like what is happening to our country. So I've heard that a number of times from voters, and it surprises me. but I'm glad to see it. So there's a lot on our shoulders right now because people are expecting change, and I know that we can't possibly make as many changes as need to be made in our 2-year term, but I hope that we can start to make a dent in what needs to be changed in our state.
You still have 15 seconds.
Okay. And the foreign woman that I talked to yesterday was a very interesting woman, and she didn't understand, what I was running for, and explained how there's a group of senators and there's 50 of those and 100 House. Yeah, okay.
Probably have time for one more audience question if we have one, and if not, we will. All right. So we're going to wrap up, and I want to thank everybody who asked questions. I want to thank the candidates for being here. I have 2 plugs to make. We have a spooky stroll to the polls next Saturday, October 27th. It's for early voting, so wear costumes as long as your face is not obscured, because they're going to check that on your ID. So you come with us at 1 o'clock. We're meeting at Matchbox downtown Lafayette, and then we're going to stroll on down to the polls because it rhymes and it's fun. And another plug is just for this whole organization, this coalition that we had. The Working Hoosiers Vote was started by 4 organizations: Greater Lafayette Immigrant Allies, Surge, Younger Women's Task Force, and Greater Lafayette Indivisible. It's been great. Personally, I've met so many people through it. It's been really fulfilling, and I encourage everyone to go sign up for any of these groups. They're all great. There's information over there to learn more. Really, you get to learn your community more. You get to meet candidates. You get to meet people. And just following up on what all the candidates said too, meeting people on door, it's such a different experience than it is just hearing everything filtered through Facebook or the news. People will really engage you when you're talking to them in person. So that's my plug for that. Let's see if I forgot anything. I don't think so. Oh, early voting. Don't think of November 6th as the day to vote. Think of it as the last day to vote. We have a lot of early voting opportunities here. We have several tomorrow. The one in Lafayette is at Feller Foods from 8 to 12.
That's in West Lafayette, I think.
It's in West Lafayette. Don't take me reading things off a chart right now. You can find it at bit.ly/TippyVote2018. That'll take you to the early voting schedule, and you'll learn way more. I think any of the different organizations' pages, Facebook pages, will also have that information if you want to know more. And there's more over there, Chris is telling me. So we're going to give you guys a closing statement, and then we'll wrap up. And I want to thanks everybody for coming out. It's been great.
I want to thank everyone that put this together and everyone that's going out and knocking on doors and caring about the fact that people get out and vote. Thank you, because I know that your vote is your voice, and if you end up voting for me, you're using your voice and hoping that I will bring some of the change and some of the opportunity that you would like to see. And I want you to know that if you vote for me, that I will do my best not to let you down. I can't promise I won't ever let you down, but I will do my best to put people first above corporations and money. I will put people first above anything. I really want to be a state representative because along this journey I have learned that when you have a voice and you use it, that you can make great changes in the world, and I would like to do that along this path. So thank you very much for listening to us. I know sometimes politics is a little hard to listen to for over an hour, so thank you.
I'm Sherry Shipley, Indiana State State Senate, District 22, and I would like your vote. This has been a great experience. One of the coolest things is getting to know all the awesome people on the ballot, especially the 13 amazing women that we have on the ballot. But I want to take some of my time. There are some other candidates here who are stepping up, and one of the things you have to remember are all races are really important, not just these races, not just the Toby Beck and Joe Donnelly races, but all these races are important. So I'm going to yield my time to the other candidates. So can we stand up and introduce yourself, please? Yes, and I'm just very proud to be on the ballot with these people and these people up here. It's been a great experience. It hasn't all been a great experience. I will not tell you. I am like rock star tired right now. I've had serious gut punches from people that I thought were my friends, but you just get back up the next day and you go out and you do things like this and you talk to people and you know why you're doing it, and it's just like you have to do every day. When you take a gut punch, you get up, you keep going, and you make it better, and that's what we want to do. So thanks for coming tonight.
And I'm Chris Campbell. I'm running for state representative for District 26. If you're in my district, I would love your vote. And I don't plan to let you down, and I will work hard. I am very happy to see that so many people came out today and care about what we have to say, because we care about you, and we want to make sure that you know that we're here to work for you. This is the first time I've been on the side of the ballot as a candidate. I've worked for many years behind the scenes with many candidates. I've seen a lot of apathy year after year, and I've helped find candidates, and it's oftentimes very difficult to find candidates. So this year it's so exciting to see so many people step up. I didn't even realize there were so many races that people could run for. I started out on the Wabash Township Board position, as some of you probably know, and then a couple months ago, I was asked to step up to this level. And I started looking around thinking, but what about these people? And they said, no, we want you to do it. And I said, okay. And I know that it's so important to me, and it's so important to this district, that I did step up so that we would have a voice. Thank you.
All right.
And we did have to submit our financial report today, but you can still donate to all of our campaigns if you are so inclined.
Yes.
I want to thank our great timekeeper, Ashna, in the back. And Angela. Thanks, Chris. Thanks all the candidates for coming, and thank you again for coming out. Yeah, we're going to wrap this up, so thank you.
We should have had empty chairs for our opponents.
We should have.